Thanks so much for joining me today. I'm Russell Hendrickson, the CEO at Practical Data Solutions. And today we're going to be talking about advancing nephrology performance through data-driven strategies. So often today, we talk about being data-driven and the importance of using data to help improve performance, drive better quality, even just make sure patients are, satisfied and recommending your organization. And that's what we do here at PDS. Our goal for the last 25 years has been to help organizations, healthcare organizations, nephrology organizations use analytics and reporting to improve performance. And we do that focusing in three key areas: operations, clinical analytics, and financial analytics. That's what we do, and that's what we know. Why is this so important? Well, the reality is your nephrology practice can't work with just off-the-shelf analytics. It doesn't really focus. It doesn't help you get to the metrics you need, that sort of higher level of detail that if you don't have tuned can be the difference between good performance and great performance. So when we talk about the success in nephrology practice and improving performance, we really have to talk about those five key cornerstones. How do we ensure the patients have just the best patient experience, and how do we measure that and convert it into KPIs? Think about operational performance and financial performance, and of course, clinical and quality, so important. And even making sure that our employees are engaged and satisfied, which ultimately, as you can see in this circular diagram here, will also help then drive the patient experience, which drives our financial performance, et cetera, et cetera. So it really is, somewhat of a circular process that is self-improving. Leadership needs good data to understand where things aren't working. So let's look at just a few examples of dashboards. We think about operations, we think about getting patients in the door. Usually the first thing we want to understand is, how many patients are we seeing? How many dialysis visits are we doing? How many office visits are we doing, or procedures? So really want to understand our volumes, which usually, people think of operationally. How many patients are we seeing per month? Is that growing? Is that declining? And even in some cases, we may even want to look at what are we seeing patients for and understanding our diagnosis mix. You'll notice on this dashboard, a little more operationally driven, we have that very important average appointment lag in the bottom left corner, trying to cull out some of those key metrics that we want to understand. One, are we getting referrals? Is our referral rate dropping or is it increasing? And of course, are we seeing new patients into the practice? So, fairly easy to see, but we're able to correlate some different metrics. I also just love this patient satisfaction. Are they happy with our practice? And are they feeling it's easy to get in and be seen when they need to be seen? If we also want to look at some financial metrics, kind of the heart of how are we performing, we certainly want to look at things like understanding charge payment adjustment trends, certainly understanding our payer mix, how quickly are we billing out charges, but also correlating, is there something going on with our scheduling or cancellations or no-shows that maybe has changed, and we need to understand what's the financial impact of that. On the back end, critical that we understand things like our match collection rates, what's going on with our days in AR, and even our denial and denial recovery rates. If we're not getting paid, or if we should suddenly start getting a lot of denials, it's just critical that we have those metrics that we need. On the other side, when we think about quality performance, right, are we able to track and appropriately measure a lot of our different quality metrics that may be coming from our payers with any sort of value-based care contracts? Typically, and what you'll see here, we often like to start with how are we performing on our MIPS quality metrics. Whether we're being paid on them or not, we still want to make sure we're doing the right things for our patients, or even having good data when we think about changes in contracts or changes of things that are coming. So here you can see not only our performance as a group on the metrics that we're hitting, but we've also then broken down on the bottom of the screen here, and I'll zoom in just a little bit. You can see those physicians who are underperforming on some of our quality metrics, we've sort of called out, not to so much, shed heat, but to make sure we understand where we may need to change or better support those physicians so we're hitting those quality metrics. And then, of course, dashboards, like anything, need to be customized to what's important to your organization, and maybe we want to call out and measure, what are the number of patients on dialysis, and are we trending that, or how is that changing? So what we've looked at here is a couple different static dashboards that a lot of organizations still working in Excel. Some of them are starting to use visual tools. But the key is, no matter what we're doing, it's having the right information and having it at our fingertips. And the power of being able to blend data and correlate metrics is critical. More and more organizations today are moving away from Excel into tools like Power BI and Tableau. There's a lot of great visualization technology out there that's easy to use, but it only works only if we have the right KPIs for our nephrology practice. If we can measure the things that are important to us and then deliver them effectively so we can interact with data or understand performance gains. So what we're looking at here is an interactive dashboard where I can point and click or drag and drop and highlight different sections of the dashboard to focus in on the physicians and their performance. In this case, what we're looking at here is a visual dashboard that is measuring the performance and the number of patients being seen by each physician per 4-hour session. So in this case, the physicians on the left side of the screen are performing above our practice average and seeing more patients in a 4-hour session, anywhere between 16 and 27 patients per hour. And the patients to the right of this line, which is our department average, they're performing below the practice average. What's interesting though is we can then calculate, and if I just focus, let's say on the bottom 6 physicians here, it'll highlight those 6 physicians. We can estimate the average revenue per visit, and then we can extrapolate and predict how much more revenue would we see if these physicians moved up to the department average or were performing similar to their peers on the higher side of our benchmark. And that's really what we're trying to do with data and having the right metrics to focus. We're trying to make sure we can understand and manage on those performance gaps, being data-driven to improve our organizational performance. The way we do that, having the right data at the right time in front of the right people. And that's really what we do here at PDS. But much of what we do can't be done if we don't understand the data behind it, how to structure that data, and how to deliver it. So whether you're using Power BI, Tableau, whether we're trying to understand clinic performance, operational performance, patient satisfaction, or even calculate out physician comp, we have the right data in front of us to make the right decisions. That's what we do here at PDS, and we'd love to talk to your organization and understand where you're doing well, but where we could help you move forward in your data-driven journey. Please feel free to contact us. We'd love to hear from you.